What's going on, sports rehab experts?
Let's play a little game here. Who thinks this athlete tears their Achilles or not? Type it in the comments below.
You see, many people will go off and blame other things such as the turf, such as training volumes, workloads, being weak, things of that nature to why rupturing an Achilles happens. Age, especially those weekend warriors who love to go out and play recreational basketball at the YMCA or your Lifetime Fitness, love to blame extraneous factors for why Achilles tears happen. And here's the secret. Usually it's more about how you use your Achilles more than anything else. Now I'm sure all the strength coaches are going to be like, oh Greg, you got to be strong at the foot. You got to be strong with your Achilles tendon because that's going to prevent all the injuries in the world. Well, in the day and age where strength and conditioning is more prevalent than ever, we have more Achilles tendon tears than ever. So it might not be as simple as just getting stronger. But the good news is that it doesn't need to be complex either. It can be very simple. And this is why I love this video right here, because it shows exactly what you should do if you land or explode out of your Achilles tendon. Most people tear their Achilles tendon when they're trying to take a step backwards, or what's considered a drop step, to start accelerating forward. In this case, the individual, he is catching a football, trying to stop backwards momentum to start attacking going forward. You'll see this all the time in basketball when people take a drop step to plant their foot backwards to start creating an acceleration angle to move forward. Now, lo and behold, this is exactly what the weekend warrior middle-aged athlete is fearful of, is snapping their Achilles in this position because they just don't know what causes it. They tend to blame their age for it. If your intent is to move forward, you better use your Achilles tendon in your foot the way moving forward is intended to be done. Now, if you ever watch a sprinter come out of the blocks, what you'll see is that the sprinter, their torso moves forward, their leg moves forward, and their heel rises up and lifts as they go forward. Because we're, after all, trying to travel forward, right? So it makes sense that everything goes forward. What happens when you're trying to move forward, but you're trying to, first and foremost, stop backwards momentum? Well, the way to stop backwards momentum is to apply a force that gets you to go forward. So actually, you're trying to accomplish the same thing. So it makes sense that the same thing should occur. But this is a yielding force, meaning you should be slowing it down. So what we don't want to see is the Achilles drop towards the heel and the knee to hyperextend backwards, or really furthermore just to extend backwards and the heel drop down towards the floor. If that happens, that means you are moving backwards. Try this for a real quick example. Walk backwards. You have to extend your knee and your heel drops down towards the floor. So if we were trying to move forward, it would make sense that our knee starts going forward and our heel starts lifting up. This is where the triple extension lifters get all hell-bent because triple extension happens, right? Well, triple extension is just a follow through after you applied force. Look at where you applied force down into the ground. The knee is bent, the heel is starting to lift up. And even if the knee does fully extend at triple extension, which again, usually you are in flight in that phase, meaning you are off the ground at that point in time, but you'll still notice as the knee extends, the heel is lifting and moving forward. So again, what we don't want to see is the heel drop and the knee extend backwards. You do that, that's how your Achilles pops. Knee moves forward, heel moves forward, your Achilles will be happy with you. And it has very little to do with strength. Sure, strength can give you a buffer zone from something happening because inevitably in sports, you'll get into a bad position and things don't always happen perfectly in sports. But if we understand how to move correctly, we reduce our exposure in sport significantly, because that's what the middle-aged athlete likes to say, right? It's just number of exposures, right? I've just been exposed to it for so many years that inevitably it's going to happen. But if you learn to move differently, or move in an ideal fashion that reduces the number of exposures that you have there, suddenly that becomes less of an issue, that becomes less of a concern. That foot plants into the ground, that heel stays planted, you minimize how much that heel drops, and then as you start to move forward, that heel needs to move forward, and your knee and torso need to move forward as well too. Don't let that heel drop, knee extend, because your Achilles inevitably will pop. Just give it enough exposure. So this is where I become frustrated when people turn a good thing, such as a forward sled push, into a bad thing. They don't understand how to push the sled forward. When they push the sled forward, they're focused on triple extension again. Their knee extends back, their heel drops down every step they take forward. That's not how we want to push forward. When you push forward, that heel should be lifting, and your knee may or may not fully extend, but your knee and torso travel forward. Everything is moving forward, especially at your heel. And this is where I get really irritated when I see other physical therapists who try to come up with this sexy exercise for Instagram or YouTube, and they attach a band to the prowler or to the sled push to do terminal knee extension, because this is a great exercise for knee pain in physical therapy world, is just sit here and straighten your knee out. That's going to fix all the world's knee problems. Sure, it might be useful in a general sense, but let's not apply it to locomotion. That's not what happens in locomotion. Understand what's happening, and you'll be a much better clinician, and you'll be a much better athlete to avoid and reduce your risk for injury. Now, if you're dealing with pain or injury and would like somebody to help guide you into an alternative route that doesn't involve just perpetual, endless physical therapy sessions, it actually turns into what would be considered performance training while reducing your risk for injury, hit me up, greg@sportsrehabexpert.com. We got a couple different options for you. I'll lay those out and you can choose what works best for you. If you're a physical therapist, athletic trainer, or strength coach who would like to learn more concepts such as this to better help your athletes and your clients out, hit me up, greg@sportsrehabexpert.com, or check out our webpage, sportsrehabexpert.com, as we have courses that you can earn continuing education credits for that help you better apply this knowledge for your clients to help you get better outcomes, make your clients happier, and help you continuing doing what you love to do, which is help other people.